The day I went to the hospital, I was working here on my farm. The things that you hear, oh, your arm's gonna go numb and you're gonna have some pain in your chest and that type of thing, that didn't really occur. What I did experience was that overall chest ache and then the sweat. Ultimately, I learned those were all the signs of a heart attack. But with that being said, you always sort of assume it's not gonna happen to you.
The day that he came in, he just knew something wasn't right, and he knew that he needed to be seen soon. He got to the emergency room at Bronson Lakeview Hospital. They recognized the fact that he was having a heart attack, and he was transferred directly to the cardiac cath lab at Bronson Methodist Hospital.
When I was at Bronson Lakeview and they told me that I was experiencing a heart attack, the first thing I thought of was my kids. I was worried about not being there for them, not being able to see them grow up.
Joe was very lucky that his neighbor was available to take him to the hospital. I was halfway across the country. Without the neighbor being there, it would have been a very different story.
Joe had a left heart catheterization. He was found to have a complete blockage in the artery down the front of the heart. After we defined what the problem was, we were able to fix his heart attack by doing a balloon procedure and implanting a stent. Joe had a very good outcome. He is a young man. It's fortunate that he recognized that he had chest discomfort quite early. After several months of appropriate therapy, the pumping function of his heart returned to normal.
From the time that I was admitted to the time that they finished took less than 2 hours. They were phenomenal. Hopefully you never have to go through this, but if you do, Bronson is certainly the best place to go.